Hi doctors, welcome to the new episode of our A to Z series where every day alphabetically we discuss one of the most repeated previous year topics of INI-CET, NEET PG and FMGE. And today's episode is episode D where D stands for Delirium Tremens. Now let's begin our discussion with solving 3 MCQs and later we will learn all the key features about our today's topic. Our first MCQ is after 72 hours of cessation of alcohol, which of the following withdrawal symptoms can be seen in the alcoholic patients? A. Seizures, D. Delirium tremens, C. Tremors and D. Hallucinations. So which option do you think is the right one? Yes, option B, delirium tremens is the right option. Our next question is, what is the etiology of delirium tremens in a 48-year-old male who presents to the emergency room with symptoms of confusion and generalized body tremors, and he has a known history of heavy alcohol use? Option A, acute infection, B, fatty liver, C, gradual withdrawal of alcohol, and D, small dose of regular consumption of alcohol. Well, yes, the right answer is option C, gradual withdrawal of alcohol. And our last MCQ before the discussion of this topic is, how would you treat a patient who is a long-term alcoholic and is currently experiencing seizures, altered sensorium, auditory hallucinations and secondary delusions? With his last drinking being 2 days ago, the patient has consumed an average of 24 units per day for the past 10 years. 1. Diazepam, 2. Thiamine, 3. Naltrexone, 4. Flupentixol depot injections. So the option is, we'll take 1 and 4, B 1, 2 and 4, C 1, 3 and 4 and D 1 and 2. What option do you think is the right one? Yes, the correct option is option D. That means we'll take diazepam and thiamine. So now let's see the key features of delirium tremens. Delirium tremens is a severe and potentially life-threatening withdrawal symptom that can occur in alcoholic patients after 72 hours of cessation of alcohol. Let's discuss about the symptoms. After minor withdrawal, there are complaints of tremor, anxiety, nausea, vomiting and insomnia. Whereas after major withdrawal, there are complaints of visual hallucinations and auditory hallucinations, whole body tremor, vomiting, diaphoresis and hypertension. Delirium tremens is characterized by a collection of symptoms including mental status changes which include delirium, which is marked by confusion, disorientation and changes in cognition and perception. The person may have difficulty focusing or maintaining attention, exhibit rapid or unpredictable mood swings and experience hallucinations, typically visual, and delusions. Autonomic hyperactivity. This refers to excessive activity of the autonomic nervous system and can present as increased heart rate, tachycardia, high blood pressure, hypertension, sweating and fever. The person may also experience tremors, especially in the hands. Psychomotor agitation, restlessness, agitation and an inability to sit still are common features of delirium tremens. The individual may exhibit purposeless movements, pacing and irritability. Other possible symptoms include insomnia, vivid and unpleasant dreams, nausea and vomiting, and sensitivity to light and sound. Treatment. Drug of choice for alcohol withdrawal is benzodiazepines. In patients with delirium tremens, IV lorazepam is preferred drug. Thiamine is also given to prevent Wernicke's encephalopathy and Korsakoff syndrome. Now let's go through the timeline of certain withdrawal symptoms. Tremors occur within 6 to 12 hours of alcohol cessation, involuntary shaking of the hands, arms or other body parts. Sweating occurs within 6 to 12 hours of alcohol cessation, profuse sweating especially on the palms or forehead. Nausea and vomiting occurs within 12 to 24 hours of alcohol cessation. feeling of sickness in the stomach accompanied by vomiting. Anxiety occurs within 12 to 24 hours, restlessness, irritability, and a sense of unease or tension. Insomnia within 24 to 48 hours, difficulty falling asleep or staying asleep during the night. Hallucinations within 24 to 48 hours, sensing things that are not actually present, visual or auditory. Seizures occur within 48 to 72 hours, uncontrolled muscle spasms or convulsions. And last, delirium tremens occur within 72 hours or later, severe confusion, disorientation, hallucinations, and agitation. So, thanks for watching, and that was all for our today's episode. See you in our tomorrow's episode, and that will be episode E.